Wahousehold Halt. Hello, good day, Chairwoman Hegman, Ranking Member Ledger Fernandez, and members of the committee. And Che, Squeeze, my name is Jared Michael Erickson. I'm the chairman for the Colville Business Council, which is the governing body of the Colville Tribes. Thank you for inviting me to testify in the Purchase of Deferred Care Improvement Act. The Colville Tribes is a direct service tribe, which means, that all the health care associated with the billing, administrative, and support provided by the federal IHS employees, which means the health care and associated billing and administrative support is provided by federal IHS employees. We have begun the process to contract all IHS functions under the Indian Self-Determination Act, but this process will take time. In the meantime, we are trying to manage the best we can with IHS overseeing health care delivery on the Colville Reservation. As discussed in more detail in my written statement, for years, IHS has mismanaged the Purchase Referred Care program at the Colville Service Unit. This is one of the main reasons that we're working to contract all IHS functions. Purchase Referred Care, or PRC, is a program where IHS beneficiaries receive care for private non-IHS health providers when IHS is unable to provide the care at its own facilities. From 2017 to 2022, the IHS Portland area office administered the PRC program at the Colville Service Unit. IHS never explained to the Colville Tribes why it took the PRC program away from our local IHS employees and administered it 350 miles away in Portland. During this time, the PRC program was administered so poorly that we can trace it to the deaths in our community. IHS required on an annual basis our members to produce utility bills, certificates of Indian blood, and other proof of tribal enrollment, and other information not required by the IHS regulations or the IHS handbook to get PRC services. Those who were unable to produce this information either went without care or obtained care on their own and subsequently faced third-party collection agencies when IHS refused to pay the services. If a referral for PRC is secured, there's no way to predict if IHS will pay the provider. When IHS does not pay PRC providers, the providers send the medical bills to our child members directly. IHS mismanagement of the PRC program at the Colville Service Unit has created a domino effect of negative outcomes. When IHS does not pay the PRC providers, the providers will assign the debt to third-party debt collectors, even though Section 222 of the Indian Healthcare Improvement Act generally states that individuals are not liable for bills associated with authorized PRC services. PRC providers rely on the boilerplate consent forms that they require all patients to sign as an alternative basis to pursue the debt. Being referred to collection agencies negatively impacts child members' credit scores, which results in higher interest rates for mortgages and consumer loans, and in some cases, the inability to obtain credit for financing altogether. Many child members on the Colville Reservation have had their credit negatively impacted through no fault of their own. For child members who choose to pay medical bills for PRC services out of fear of having their credit impacted by collections activity, IHS does not have an accessible system to reimburse them. IHS mismanaging the PRC program resulted in many Colville tribal members avoiding IHS care altogether out of fear of being saddled with the medical bills and having their credit negatively affected. The Colville Tribes is aware of the PRC health providers that have refused to schedule appointments to tribal members who have unpaid balances from previous PRC purchase orders that IHS has not paid. We're also aware of the providers that have dropped out of the PRC program because IHS does not pay them for the service they provide. Or there are many issues with the IHS management of the PRC program and the Purchase of Fair Care Improvement Act would address the critical issue of tribal members being sent to collection agencies. The bill would amend Section 222 of the Indian Healthcare Improvement Act to clarify that individuals that receive PRC care that is authorized by IHS shall not be liable to any provider or debt collector. The bill will also preempt the use of boilerplate consent forms that providers require patients to sign from being used to target child members through collection agencies. Finally, the PRC Improvement Act would require IHS to reimburse child members who paid medical bills for IHS-authorized PRC services within 30 days. This is only fair because PRC bills are IHS obligations and child members should be made whole when they pay out of their own pockets to avoid collection activities that are a result of IHS mismanagement. The Colville Tribe urges the committee to take whatever steps are necessary to secure enactment of H.R. 7516 into law. I would be happy to answer any questions the committee may have. Lim, thank you.
Thank you, Mr. Erickson, for your important testimony. The chair now recognizes Ms. Sherry Beretta for 5 minutes.